I'm Scott Mark with Medtronic. We're a medical device technology company. We produce therapies that help people address the burden of chronic disease. Over 60% of deaths come from chronic disease, and 75% of the cost of healthcare occurs with chronic disease, so we feel that's the place to have the biggest impact in healthcare. And we're a very patient-oriented company. Every 4 seconds, we improve the life of a new patient with one of our products or therapies. That's a very important measure for us. And we have therapies that cross a variety of chronic diseases, including cardiovascular disease, diabetes, neurological disorders, chronic pain, spinal disorders, and so on. For us, the focus is on patient outcomes and on alleviating the burden of chronic disease for patients. So to engage in the startup world in India, I think we're very excited to see the amount of health-related activity in the startup community here. It's really exciting to see some of the efforts happening. Medtronic does have formal programs to engage with outside innovators. We have Innovate with Medtronic. We also have a program called Medtronic Eureka, and there's information about both of those through Medtronic.com. Those are formal programs we have to engage with inventors or people with ideas. We also, for medical practitioners who do investor-initiated research that advances the science of medical devices, we have support programs in place for that. And I think apart from that, we're just really interested to learn from the startup community here what the best way is to address challenges around access and awareness of chronic disease here in access to healthcare and awareness of chronic disease here in India. Those are 2 big challenges to getting the life-improving and life-saving therapies that we have out to patients who need them. And so we're really excited to see some of the innovation happening in the startup community around addressing those challenges. To address going into new markets with challenges such as India, we work a lot with local partners. We work a lot with people who have been in the space and who have done creative market awareness and assessment activities to try to understand better how to enter the space. The other thing we've done is try to experiment with different types of ways we can approach the market through business model innovation. And so we recognize that the methods that we've used to get therapies to patients in other markets might not necessarily work as well in places like India or China or other markets with different financial structures around therapy and again different access to healthcare. So a lot of what we've done is try to look at the economic value of our therapies in addition to the clinical value. We're a very clinical and quality focused company, but again we recognize that a big part of getting people to benefit from our therapies is making sure that people have access to them and that there's a good economic value proposition that's market specific for how we can ensure that people within that system will get access to those therapies.